And tonight, as New Hampshire voters are leaving the polls, we're learning that the issue of health care is certainly at the top of their minds, and many want to know who's going to make their prescription drugs more affordable. Skyrocketing insulin prices have made diabetics across the country some of the hardest hit, as ABC's Devin Dwyer discovered many are struggling to get by and looking to the 2020 field for answers.
In the foothills of New Hampshire's snowy White Mountains, the state's live free or die motto has become a rallying cry for change.
It is insulin or death.
Yeah.
There's no other treatment for type 1. There's nothing you can do. If it's $1,000, I'm going to pay $1,000 because I have to.
Stacey Patterson, born and raised near Concord, was diagnosed with diabetes at age 37, one of an estimated 7 million Americans who need daily injections of prescription insulin to survive.
Did you comprehend at that moment how impactful this was going to be on your life?
Absolutely not. Your pancreas no longer produces any insulin. It affects everything. Your sleep, when you work, if you exert activity, it affects everything.
And your finances.
Oh, yeah. Yeah.
Patterson works 50 hours a week at a local eye care chain. She gets insurance through her employer, but with a high deductible and copays, she's barely getting by. Prices for insulin have jumped nearly 300% in the last decade. The drug's been around nearly 100 years, but lax regulation and market pressures have sent prices skyrocketing.
How bad is it right now?
It's terrible.
30-year-old Brittany O'Donnell of Chichester, New Hampshire, runs a grassroots network of people struggling to afford the drug.
Everyone's depending on each other for tips and tricks on how to afford these things, how to obtain these things.
So are we talking tens of people, hundreds of people, thousands of people in New Hampshire?
In New Hampshire, you're probably talking thousands still.
Amanda Bowen of nearby Goffstown is one of them.
This is what delivers the insulin subcutaneously, and this is the CGM.
A freelance photographer and divorced mother of 2 teenagers, she's been piercing herself to test her own blood sugar and inject insulin since she was 8 years old. Every month for the rest of her life, she'll need to buy a mountain of supplies.
My medical expenses far exceed my income.
How much are you making a month now?
I'm capped at $1,300 in order to be qualified for Medicaid.
Medicaid is a lifeline for Amanda, but not a solution.
The choices that I have available to me are limited. So in essence, I feel trapped. And my son is type 1 as well. Aiden, he's 14, and I hate to think of what it is that he'll have to go through if this problem isn't addressed.
Diabetes can be crushing, even for those with private insurance. A recent study found 1 in 4 Americans with the disease ration doses of insulin because of cost, a dangerous practice that Amanda, Stacey, and Brittany all say they've tried.
My pump said it was out of insulin. I still tried to draw back whatever I could.
Did you let yourself run high and reduce the dose?
I did.
When was the moment that a light bulb went off, that you couldn't keep doing that? 2017,
when Alex Smith died.
Alex Smith's story made national headlines. A 26-year-old diabetic from Minnesota, a young restaurant manager just starting his career. His mother, Nicole, said he had just aged out of her health insurance.
Basically, he was asked to pay $1,300 for his month's supply of insulin. And he didn't have $1,300 in the bank, and so he left. He went home without his insulin. And his body was found a few days later. He died.
It turned from an aha moment to, I'm angry.
It is heartbreaking because if you knew what it was like to feel yourself slowly dying, it makes me so sad to think that in the greatest country in the world, people had to start a GoFundMe for insulin or
drive to Canada
to get insulin, which I've tried.
It's a trip more Americans are making, since in Canada, the life-saving medication costs just 1/10 of what it does in the U.S. Last summer, we joined a group of diabetics led by presidential candidate Bernie Sanders on a bus trip north of the border to stock up on cheap insulin.
How are we a few minutes from the American border and she's going to be paying 1/12 of the price that she pays in the United States?
Insulin's been around a long time. You think it'd be able to knock the prices down?
Ray Clement of Manchester, Amanda Bowen's father, voted for Donald Trump. His daughter is a fan of Bernie Sanders.
It'd be nice someday. I would think that they will take care of that problem, because a lot of people are diabetics in the country and everything else, and I think it'd be a great benefit to them. Yes, yeah.
Sounds like something you guys maybe agree on.
Yeah, we do on that.
How to get there.
How to get there.
How to get there, right.
What do you think is the answer?
Not 100% sure if this is the answer, but Medicare for all. I would love to be able to walk into a pharmacy, get insulin at a $0 copay, and continue to live my life.
As the healthcare debate continues, the stakes for insulin-dependent diabetics in 2020 could not be higher. Do you feel like your politicians are listening to you?
I hope so. I've heard a lot of great talk. I've heard a lot of people offer Medicare for all, or who have offered caps or to hold drug companies responsible. Even things like the importation, I would just love to see a little less pointing fingers and a little more, this is the definitive answer. I would love for a candidate to step in and say, I want to address this for you now.
And Devin Dwyer joins us now live from New Hampshire. Devin, trying to get an understanding of, you mentioned the 300% price hikes here, and that it's about a 1/12 of the price in Canada. Is there just more regulation in Canada? What's the explanation for that price discrepancy?
Well, the simple answer, Lindsay, is that there are price controls in Canada for insulin. They actually have a review board for prescriptions there which set the prices. It's one of the ideas that a number of the Democratic candidates have put on the table in this campaign. Of course, it faces some stiff opposition from the drug companies. Republicans oppose it as well, but I'm here at a results watch party at Dartmouth College. As you can see, these guys waiting for the results to come in. The issues, healthcare, on the top of a lot of voters' minds up here. Lindsay?
And regardless of who wins in November, is there any chance that lawmakers will be able to come together to lower the prices of insulin?
Well, there's a lot of hope. The good news is that Republicans, Democrats, independents, and most polling support the government in this country intervening to set the prices in some way of prescription drugs. A number of proposals are on the table, from allowing Medicare to negotiate those prices, expanding the use of generic drugs. Of course, all those voters in the piece you just saw that we talked to said any of those steps would go a long way at making their lives better. Of course, it's going to come down to who is president and who has control of the Congress.
All right, Devin Dwyer for us. Thank you. Live from Dartmouth with all those young voters perhaps voting for the very first time.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.